Welcome to Fair Observer. Today we welcome Sofia Hamilton, who is Harm Reduction Fellow with Young Voices. She otherwise is Health Policy Analyst. Welcome, Sofia. And since you work with health policies and you wrote quite an interesting piece recently, which I read, A Crunchy Libertarian's Guide to Making America Healthy Again. There is a little play with an acronym there, and you'll explain us that one. Especially, please give us an introduction to how the American health system works. Because our audience is international. Many people don't live in the United States, never even traveled there. So please explain. Let us know.
Well, thank you so much for having me on today. I'm very excited to talk about the state of healthcare in the United States and our healthcare system. It is a bit of a complex topic to break down, so I'll do my best to give a high-level overview. So it should be no surprise to at least to the listeners in the United States that Americans are not very happy with the state of healthcare in our country. And that's because it's pretty broken, it's pretty dysfunctional, and it's incredibly expensive for most individuals in the system. So we have two systems at play at both times. We have government-run healthcare, which has multiple different programs in there. So that's Medicare, Medicaid, and there's different programs within those. And then we have private insurance. And so that's typically insurance that you either buy yourself on the individual marketplace or that you get through your employer. So most Americans that are at least living above the poverty line are getting their healthcare insurance through their employer. So it's tied to their job. And so that leads a lot of complications because there's limited choice in the healthcare insurance that you can get because your employer chooses for you. And if you were to lose your job or change jobs, then your health insurance changes or you lose your insurance. So there's really no great system to be in because if you're in the government health insurance, you have very limited options. You're not paying really anything or much at all for that insurance, but you have very limited options, very limited providers that are taking that insurance. And if you're on private government or private employer insurance, you don't really have any choice at all. Maybe you have a choice between three plans, and if you lose your job or change jobs, you're going to have to start over and learn the insurance again or find insurance yourself on the individual marketplace. And that insurance is still pretty expensive. Really, no matter what, you're paying a lot of money for your healthcare, even if you have insurance. So, rightfully so, a lot of Americans are just not happy with the healthcare system and insurance system in our country because it's unaffordable and the quality of care is just not great. And even if you can get good quality care, it takes a long time to get it, and you're tending to wait months to get in to see the doctor that you want to see.
So that's astonishing because what we hear is that America is one of the countries that spends the most on health.
We do
Or
spend the most money on healthcare out of all of the countries, I believe, or at least all of countries similar to the United States. And that's because our insurance system drives up the costs. It goes back to the basic principles of economics. So we've incredibly increased the demand through all of these different insurance programs, and that has driven up the price. Our insurance system also places a lot of mandates on providers and insurees and employers, and that's driven up the cost because you now have to go and get certain exams and doctors have to do certain things. And that just increases the amount of things that we have to spend money on. And so the price
uh,
keeps going up and up.
so this is the administrative side of things. That sounds is a bit like a snake biting its own tail. How is it the relationship with between the people and medicine, the people and science? Do people still trust science? do people trust what the government is offering? I remember hearing quite a bit of a shuffle around the COVID time. And how can someone have like a decent relationship with the family doctor? Does it still exist, the figure of the family doctor?
So the COVID-19 pandemic really placed a lot of distrust in the average American in the medical system and in government. Americans don't tend to not like being told what to do. And so mandates on vaccines, they tended to just distrust. And there was a lot of back and forward in the guidance, which is totally understandable. No one knew what was going on. But I do think in hindsight, it could have been handled better. It just placed a lot of distrust in our public health system. And so Americans are now distrusting of a lot of the guidance that the government puts out on healthcare. And they also are just not really having that relationship with their doctors anymore because of all of the mandates that I was mentioning earlier that have been placed on and that insurance is placed on individual providers. We now no longer have like a typical relationship with our family doctor. We tend to have to wait weeks to months to get an appointment with our doctor. And that appointment, if you're lucky, is going to last 15 minutes, and it tends your doctor just tends to not remember who you are, your name, anything about you because they're rushing between patient to patient and they're really not doing the typical job of a doctor anymore because of all of these mandates. They're more doing the job of an administrator. They're filling out forms, checking the boxes, making sure they meet all of the points on a checklist, and they're no longer just doing the traditional doctor provider role.
Are there doctors or doctors' organization associations complaining about this situation?
Oh,
Organized.
almost every doctor is. Whenever I go to the doctor, I love to just ask them about how their job is, how they're dealing with insurance, how they're doing all of these documentation. AI has been incredibly helpful for them. Most doctors I've spoken to personally are using that to scribe their appointments to get a lot of that documentation done. But there's a growing movement of doctors leaving insurance behind. And so they're going into practices, private practices that don't accept insurance at all. So patients have to pay out of pocket. And that can be a bit cost prohibitive for some Americans, especially if they're already paying for insurance and then they can no longer use it or they can only get limited reimbursement. But the positive of that is you get better care with your providers because they're no longer limited by the mandates that insurance has put on them. So you're getting better care, longer appointments, quicker appointments, scheduling wise, and you're getting that real doctor-patient
But
relationship that we have lost.
what percentage of American citizens can afford that?
I don't have data on that. I do think it's becoming more attainable, and more Americans are also seeing the real purpose in that the doctors outside of insurance because if you break down the numbers, and I've seen this in my own healthcare, paying out of pocket to go to a better quality provider, you're going to save money in the long run. If you're investing money in your health, typically, this is for typical situations, you're going to be spending less money. When you're going through insurance, you're still spending a lot of money. And so it somewhat balances out. And in my case, I saw that when I was going outside of insurance in the long run for complex health issues, chronic disease issues, I started spending less money. But it is pretty cost prohibitive to get into it, especially if you're on in a government health insurance program. If you're on employer insurance, I think it's an easier decision to make, but that's because we're already spending so much out of pocket for that employer insurance plans.
Okay. So when I read your article, I was a bit surprised because we're not used to it. I mean, in Switzerland, there is a bit of a discussion in having many insurance companies or making it a state one. So that comes up every 15 years. People tend to ask, why don't we stop this complication of having many different insurance for health? insurance companies for health. Why don't we just do one and it's state run? So people fight back saying no, because then you don't have competition and then they wouldn't do the work right. And yeah, but then you have to pay in, I don't know, 26 different systems instead of one. So it's a big fight there. But that's just about where it stops being political. It's not even very much political, it's more points of view on how to run things. But in America, I understood it's become, from your article especially, then you can give us a peep on it. Uh, what is this thing with Make America Healthy Again? That sounds like another acronym, another slogan. And considering people that take care of their health, they're not hippies anymore, they're liberals or even worse, people on the far right, something like that. What is going on there? How is it
So
politicized?
everything in America is political. Everything's going to cause a fight. And healthcare definitely is political in the United States. So, the last couple of years, the Make America Healthy Again, the MAHA movement, has gotten very popular, especially through our last presidential election last year, 2024. And the whole purpose of the movement, at least at its outset, was to put focus back on the health of the United States and get our citizens more healthy because we're becoming a sicker country. If you look at other countries similar to the United States, we have longer lives, but we have sicker lives. So Americans are being sick for longer amounts of time, and that's not good. It's
Mm.
not good if you're living into old age and you're sick for much of that time. So, the Make America Healthy Again movement is really looking to increase healthy lifestyles in the United States, but it's become very politicized, very controversial. And some of it's been tied to the Trump administration, the Make America Great movement, and that's very, very difficult for many Americans to get behind. And I think the issue with the Maha movement, really at its core, is that it's not principled. It's going swaying between free market principles and state control of our health choices, in an attempt to make Americans healthier. But it's really not following any sort of principled guide. And so it goes from being ultra Democrat to ultra Republican to ultra far right to ultra far right left. And it's gotten very, very controversial. And some of the habits that are promoted in the Make America Healthy Again movement have also gotten somewhat controversial. I talk in my article about being crunchy or granola, which is just basically means that you like natural alternatives, you like to be outdoors. Like I note that I love to go hiking. I have a vegetable garden in my backyard. I love to thrift and be responsible with the environment. And that used to be incredibly liberal, hippie sort of views. And now, with the advent of the Make America Healthy Again movement, that's seen as very conservative because now those are tied to the Trump administration. And so there's a lot of infighting here in the United States on how do we make America healthy, and do it in a unpolitical, not political way.
So it seems that you have an idea on how to do that.
I I do. I think really going back to our original conversation about insurance, there's no way that Americans can get good health care right now in our system for a decent price, most Americans at least. We really do need to restore the doctor-patient relationship, and that means getting rid of a lot of these insurance mandates on providers and allowing them to act how they used to 50 years ago, where you would see your same family doctor and they knew your name. All of your doctors and your providers were working together in one group. So you're really getting comprehensive care. And so you don't have to go to these boutique practices that don't accept insurance and are cost prohibitive for a lot of Americans, especially those in state-run insurance. So I think that is the number one thing that we have to do, and just getting the government out of their way, out of their own way, and allowing Americans to make choices for themselves. But we're a far way away from making that happen here.
Mhm. Is there any kind of movement, people getting together, organizing, or I don't know. I heard some elderly, not very old, just beyond retirement age. People here, they go out of the whole insurance system and they started saving money as a group, and then they support each other. That sounds very much like communal life in the 60s, but not at all, actually. They're professionals with the retirement funds and their own homes. They just decided to get out of the system. It's been a battle because here it's imposed by the state. How would that work in the United States? Would it be possible?
That's incredibly interesting. Culturally, I don't know if that's possible in the United States. Everyone, this country is very individualistic, and so I don't know if that would happen. I will say we have a very interesting model of care that is growing more popular, and we are slowly chipping away at some of the government restrictions on it to make it more accessible to more Americans, and that's the direct patient care model. So it's kind of like a subscription for your doctor where you're paying a monthly or yearly fee for direct access to your personal doctor, and they're like an on-call provider. And so they have a patient load that is much smaller than the typical doctors. And so that's kind of everyone paying into this care system without insurance. They don't take insurance. And so it's a little different than the boutique practices that I was talking about. But you really get that a cheaper care model than you would with insurance. And it's really kind of like the community funding that one doctor themselves and coming together. Not the same model that you're talking about in Switzerland. I don't think to that extent it would be,
Well, that's
at
that's
least,
kind of an exception here too.
yeah, it wouldn't be
Let's just to
widespread
mention the
popular.
faraway exception and then see how we can use it to figure out things, to measure up things. So this is very interesting. I mean, health, we all care about health. Mm.
Mhm.
So what are people actually doing? How are people coping with these complications?
That's a good question. Um, people are people are very angry about the state of healthcare in the United States. And I think, and I really do think that's why the Make America Healthy Again movement came around. And they have very good points. You just some of them I have a love-hate relationship with the Make America Healthy Again movement, and I talk about this in my article because it again goes back, it's not principled. And so some of their points I really do like, but I don't think that it's the role of the government to be making. Like I like to make healthier food choices myself. I don't want to eat processed foods. I don't want to eat things with food dyes. And I always check the labels when I'm in the grocery store. But do I think that's the government's role to be mandating? That's where the movement starts to lose me. And so I think people are getting just more involved in this conversation in healthcare. And even though it's very politicized and there's a lot of infighting, I do think one of the good things about the Maha movement is that people are starting to care more, and it's getting to the forefront of the national conversation because everything, like I said, is politicized in America. And so we're fighting about every single thing that you could, about health insurance, about housing costs, about national defense. I could go on and on about the things that Americans care about, but now healthcare is one of the top ones. And it's not just about the price anymore. It's about how unhealthy our children are, how the rise in chronic illnesses is going up in young people, and it's we don't know how to treat them, and we're not getting good care in our typical insurance systems. And so I think people are somewhat coping by just getting more involved. And while it can lead to even more politicization and a lot more fighting and more
Yeah.
toxicity, I do think it's a good thing that people are talking about it and debating. But that kind of gets me to one of the other points that I had in my article is with the COVID pandemic and the distrust in that was placed in our government and healthcare systems on one side, the other side was absolute trust in our government and our healthcare systems. And I think we need to be somewhere in the middle there.
Yeah.
It's now become somewhat controversial with at least one side of America to question what we hold to be true in science. And at least for me, that was something that we learned in elementary school and primary school is that you question what we hold to be true. You have hypotheses, and that's part of the scientific method. But now that's controversial to question what's healthy, what vaccines to take, what food is good for you. If eggs have too much cholesterol, that's too controversial to ask. And so we have to get to a
Well,
point where we can be asking these questions, and it's not part of our cancel culture to then make those people stop talking.
there's quite something that I'm picking up, and that has to do with the culture, probably. As you were saying, we are fighting and we are getting angry at just about everything or many different topics. And they're saying, well, this can't be very good for health, being angry all the time. You know, you get your, what they, now it's old fashionable to talk about cortisol, the stress hormone being always high, or adrenaline. And that's the fight and the anger churning. And at the most, I don't know, people say that that's what gives autoimmune disorders or all kinds of strange things. So one going on the internet can get all sorts of strange ideas, some very good. There are some doctors that explain things very well, and there are some other confusing things. So I think what I hear, that the landscape is complicated. There are quite a few potential obstacles, but the positive side that you're seeing, the positive movement that you're seeing, is that people are gaining awareness on the
Exactly.
fact that there is a problem. So even questioning, learning to question science, even if there is a pushback from one part of the population that are used to, that have learned maybe to accept some kind of dogmas for whatever reason, for cultural education, doesn't matter. So that's part of a living society, that having a dialogue, maybe a very feisty dialogue, but there is something going on. So things are moving. That's what you're seeing.
Exactly. Yeah, I think especially when it goes into the chronic illness side of things, we're seeing more Americans, especially young Americans, having struggling with chronic illnesses and oftentimes more than one chronic illness. And they're just it's so expensive to get care because you have to go to so many different types of doctors. And I think one of the things that I'm very grateful for the Maha movement, even though I have many problems with it, is that it's really brought in national attention to the rise in chronic illnesses and ways to treat it, getting more money to research for those things, and people feeling empowered to do research on their own as well. We don't always have to rely on the government to figure out these things for us. We now have AI where you can search in your symptoms. I think consumer education is really powerful. I think people should feel empowered to make choices for themselves and not rely on someone else to tell them what to do, because I think that's a very slippery slope into full control. And
Hmm.
so it's hard though because we have so much information at our fingertips and so much misinformation and disinformation,
Yeah.
especially with social media and all of the doctors that go on social media. There are some good ones and there are some really bad ones, and it's hard to tell who's giving you the correct information. But I really do think that Americans need to feel, and all people throughout the world need to feel empowered to be able to do that research for themselves and to make those choices for themselves. And I think people are starting to get to that point. But we're at a crossroads here where either we let the government make all these choices for ourselves or we make the choices for ourselves. And I think people are starting to choose because for a long time we
Maybe
were
there is, yeah, maybe there is some kind of, in French we say juste milieu, the kind of measured, temperate center. So some things can still be managed by the government, like testing drugs. That's definitely not a private person that was going to do it.
Mhm.
And it takes a lot of means to do it. And then other things could be decided at a more individual personal level.
Exactly. Yeah,
But when you were giving the example of food dyes, for instance, or any other stuff that is put into packaged foods, now the big problem is that we turns out even packaging is a problem because we are eating plastic because when you
mhm,
cut the thing, there's microplastic falling into your food and you end up eating it. Um, so how do you go about, for instance, maybe you say, okay, I don't want the government to tell me if I have to eat this or that, but if the government allows a certain substance to be put in the food, the industry will invest a lot in it, and you will end up finding it a lot and having a hard time not having it if you don't want it. So that's what's going on here in Europe, in Switzerland, and in France. That's places I know the best, but every country is different. So there is a lot of food dyes, a lot of things that I don't find here at all.
mhm.
They're gone. But I heard that there still are in cereals for children in the United States. So and then an educated person can read the labels, control, check, ask AI, ask ChatGPT or any other AI, and figure out, do I want to give this to my child or not? But
Mhm.
how many people do have a sufficient level of education to get there?
Yeah, and I think that's something that I've really struggled with personally because I don't I don't want to be eating those artificial dyes. I don't want to be eating microplastics. Um, I also it's a hard question to answer because I think the government in the United States at least has a tendency to treat um poor individuals or individuals from certain communities as if they aren't functioning adults, where I think if you do empower them, they can make those decisions for themselves.
Okay,
And so I think
how
that's
do you empower them? See, someone living in
mhm,
one of those places that are really frightening to someone like me. I have as you, I have my own vegetable garden and I have like 3 or 4 markets where I can get anything organic. And there are food deserts.
mhm.
Even if the person is empowered, maybe they don't make enough money to buy a car and they don't have enough to go all the way to where there is a market and get healthy food. So how do you empower these kind of people?
Yeah, so it goes back to consumer education. So there was like a big scandal in recent years about the food pyramid in the United States and how it was just absolutely corrupted by lobbying, basically. And so it wasn't even accurate. So the education we were getting in school on nutrition, which is very limited, at least in my experience in the United States in the public school system, is not great. So first of all, you need to fix that because we all have public school available to us in the United States. It's compulsory. And so fixing that and putting more of an emphasis on nutrition. And so having more nutritious foods in our school lunch programs. that are available to low-income Americans, and that also you can buy for higher income children that a lot of them are eating in the school systems. Also, our nutrition programs. So we have like SNAP, and that's where individuals are getting money, allowing them to buy more nutritious foods. We have a lot of restrictions on what they can buy, and it's not really it's pretty nonsensical. It's saying, oh, they can only buy like full fat milk and not the 2% milk. A lot of different things. And so allowing them to have access to healthier choices and more options. I think labeling on food can also be great.
Mhm.
I get scared of I get very wary of government restrictions, at least in the United States with our history of prohibition, especially on alcohol, of banning things because it's a very slippery slope. And so if something is incredibly like if something's toxic, that should not be in the market. And like, I'm not a scientist, so I can't really opine on the toxicity of food dyes, but I know that they're not great, so that's why I don't eat them. If they are toxic, I don't want that in our foods. And I do think it's a big problem that America allows so many things that you don't allow in your country, and all of the European countries are like Fruit Loops are filled with all these artificial dyes, while your guys' Fruit Loops are like the fruit and vegetable
They're
dyes.
not the
I don't,
same colors.
yeah, it's like
They're
I don't
fa-
get that.
they're
I think
pale compared to the real ones.
I will say I know privately some companies in the United States, I think it was like the Trix cereal, they went to fruit dyes and consumers didn't like it and they switched back to the artificial dyes. And so sometimes you do have to let consumers make that choice. But if it is toxic, I want the government to get that off of the market. But sometimes people do have to be allowed to make those poor choices. I know New York City, for example, tried to ban the ultra large sodas that the entire world makes fun of the United States for
You can
having and
still go
loving.
to a big store and buy a gallon bottle if you want.
Exactly.
So
Well,
you
I think
can.
they were stopping like the big glugs or whatever they're called here from being sold, and then that was overturned, and that was really, I mean, if I want to drink a giant soda, I should be allowed to. I'm an adult. We shouldn't be serving those to children in schools, and maybe you shouldn't be buying that with government money.
I'm going to
And I
tell you,
think
I was in the United States for a year as an exchange student, and I was in Santa Fe in 87, 88. It was a long
mhm,
time ago. There were vending machines with sodas in the school. And
yeah,
and yeah, that for me that was already at the time incredible because we got water. That's it. We got water in the at the canteen, and that was about it. And we could go and drink in the bathroom.
mhm.
So a vending
That
machine wasn't unthinkable, but they were there. And if you get bored, you have 15 minutes between two classes, you just buy a can of soda.
mhm,
And and also there was a class for cooking, but they weren't really encouraging kids to go there. And I think that could be
mhm.
a good way if you know how to cook. I wouldn't say everything from scratch. Not everyone needs to spend a whole weekend making lasagna, but there is lots of things you can do in half an hour or in an hour that is totally accessible. Um, that could also help uh, make better choices.
Definitely. Yeah, I think knowing having those basic like homemaking skills
Hmm.
is so important for your health, and it's also pretty it makes things more affordable as well. If you're able to do things from scratch and you have access to the tools that you need to. And I think that's a great thing to be learning in the public schools as part of like a nutrition program. I will say though, like that's incredibly accessible to people nowadays because you can go on YouTube or TikTok or Instagram and get a 30-second reel that kind of explains to you. And so people have
Yeah,
to feel empowered to do that. And even if you don't have internet or you don't have a phone, you can go, we have public libraries where you can look that up or get a book on cooking. And so I think it'd be
I
great. It's
think
great to have both of those.
there is a bit of a problem. I grew up in an Italian family, and I literally grew up on the counter, on the table, with my mother making food, and my father as well. So I have a hard time imagining someone that never used any kitchen tools, learning to do things without the practice part, just by looking at a video. You'll cut your fingers a couple of times, you'll get burned a couple of times. So I'm just thinking maybe this could be encouraged a bit more in schools or any other venue, maybe your local organizations. I saw in certain places there are community gardens. That could be a good, interesting thing. But
Hmm.
yeah, so just to wrap this up, we found out that the health system in the United States is causing a lot of discussion. And as you said, the good part is that people are noticing and becoming aware, even if they get angry. At least maybe there is something moving. Would you like to put in a word of conclusion?
Yeah, I I think it's even though it's highly politicized and there's a lot of anger and fighting, I think it's a good thing that Americans are talking about the state of healthcare and the state of our health at this point in time. There's a lot of things that need to be fixed, and it's so complicated, and a lot of that is at the fault of the government. So in my view, we shouldn't be doing more government solutions to fix the government problem. We shouldn't be giving them more power because they did create this problem. But we need to be empowering individuals to make choices for themselves and to get education, and having that education in public schools um is
Isn't that the government again?
I mean, that is the government. So yeah, I am contradicting myself there. Um, but I'm talking more, I was meaning more in the sense of like health insurance and putting more money into the health insurance when we're not getting good care with that health insurance. And so ensuring that Americans can make these decisions through themselves through good education and in our public schools, which the government does fund and taxpayers fund,
Mhm.
and ensuring that they have access to accurate information that isn't completely altered by private business interests, and getting them involved and interested in their health, which I do think, with all of its faults, that the Make America Healthy Again movement is starting to do and get individuals really focused and committed to making their lives healthier and making better choices.
Well, thank you.
Thank you
Thank you,
so much for
Sophia.
having me on.
It'd be a pleasure, and we'll keep in touch. As long as you keep writing, maybe we'll have other opportunities. Thank
Definitely. Yeah,
you.
I'm always talking about healthcare. So if you ever want to follow my work, I'm on
We
Twitter, X, whatever you want to call it,
will do.
at Sophie Hamilton.
Wait.
Join the conversation at Fair Observer and subscribe to our YouTube channel.